Rosenhan, 1973, Being Sane in Insane Places. Study 1. I know it says background, I mean aim, ground. To see if 8 sane people who gained admissions into 12 different hospitals would be found out as sane. To find out what it's like to be in institutions and what it feels like to be viewed as sane. Background. Once again, I know it says aim, I mean background. I'm sorry about this. Difficulty of defining abnormalities. Problems with defining sane and insane. Assume that the hospital staff were competent, the individuals behaved normally, no suggestions that they had previous health problems. Sample. He used 8 participants. Now, I don't know if you heard the hesitation in my voice. That's because they're not participants. They are pseudo patients. He used 3 women and 5 men. The reason why they aren't participants is because they did not actually do the study. They were Confederates. They knew about the study. There's one 20-year-old graduate, 3 psychologists, a painter, a housewife, and Rosenhan himself. These are pseudo-patients, Confederates, not participants. Setting. 12 hospitals located in 5 different states in the USA, varied in character, old, new, good, bad, private and public. So I personally set the procedure into 2 bits, the admissions and once they were admitted. It's completely up to you how you see the procedure. I just think this is an easy way to follow it. So the pseudo patients called the hospital saying that they were hearing voices. They said that the voices were unclear but seemed to be saying empty, hollow and thud. These words placed an emphasis on their social life. They changed their names and some personal history. Each pseudo patient gave details about their own life, however. Pseudo patients, once admitted, stopped stimulating abnormalities. Some were nervous, but they all behaved as they would normally. They were given medication, but they didn't take it. They responded to instructions from staff and chatted to other patients. Each pseudo patient would have to get out by convincing the staff that they were sane. Results. Pseudo patients were never detected. All except one were admitted with a diagnosis of schizophrenia. No records of hospital staff showing that there were any doubts about the authenticity of patients. Between 7 and 52 days were spent in the hospitals, on average 19 days. Pseudo patients were not observed carefully. This led to the label of schizophrenia being given to them. Even though visitors and patients on the wards felt that they were sane, during the first 3 hospitalizations, 35 out of 118 patients voiced their suspicions, such as, "You're not crazy." Doctors are more likely to make errors due to caution. Rosenhan found that a normal family background was seen as abnormal. Study 2. After Study 1, Rosenhan faced backlash due to the distrust the research placed on hospitals and the staff. This led to a teaching hospital challenging Rosenhan to send fake patients, as they would be able to tell whether it was the researchers or not. He agreed to do this and arranged within a 3-month period to send 1 or more pseudo patients. So the staff at this hospital were aware of Study 1's findings and was informed that across a 3-month period, 1 or more pseudo patients would be admitted. Each member of staff were rating the likelihood that patients were fake. In reality, no pseudo patients were admitted. Results. Staff rated the new patients on a scale of 1 to 10 of how likely they were to be a fraud. 193 patients were assessed. 41 were assessed as being fake by at least 2 members of staff. 23 were rated as fake by 1 psychiatrist. 19 fake by 1 psychiatrist and another member of staff. Just a reminder, none of these patients were faking. None of them were a pseudo patient. He did not send any. I highlight this as this is a massive ethical issue, as even though this research was conducted due to an ethical issue in the first place of the distrust he then caused another ethical issue as potentially preventing people from getting care, causing more distrust due to this study. Conclusion. Sane cannot be distinguished from insane. In psychiatric hospitals, Rosenhan is against the use of labels for diagnosis and thought it would be more helpful to keep patients in a better environment. Overall evaluation of Study 1 and Study 2. This study is high in generalizability due to it being in varied institutions that covers a wide range of areas and a wide range of social factors. All reported the same symptoms. This is a standardized procedure and can be replicated easily. High ecological validity. There was no demand characteristics as the staff did not know that the placebo patients were not sane. As they had been admitted with schizophrenia, staff were being normal. Labeling someone wrongly with a disorder and giving them medication can change their behavior and may be seen as a form of social control. Rosenhan's study points this out. Being institutionalized can lead to depression due to poor treatment. This can affect how nurses and care facilities treat patients and the quality of care provided. Conclusions led to recommendations and changes in the diagnostic manuals, specifically the DSM-3. Weaknesses. Rosenhan was one of the Confederates himself. This could have led to bias and could have skewed the results, as they were writing down what they observed. Therefore, this was self-report, and it could have had biased interpretations due to Rosenhan himself being a placebo patient. Hospitals were assessed in the USA. They all have the same Western culture, and it's not representative of Eastern cultures. An observational method was used. Placebo patients could forget to write down information or be unable to do so. This means that they do not have all the data needed. This makes it unreliable. If you didn't know, then placebo patients had to go to their room and write down behavior. However, in their charts, placebo patients were found to have writing behaviors due to how much they were writing down during the study. This makes it reliable as they were trying to write down everything they observed. Although, on that note, writing behavior was seen as paranoid schizophrenia, so therefore this could have led to the staff seeing them as insane instead of sane. Spitzer 2005 argued that the methodology used in Rosenhan's study were flawed. Temporal validity, 1973, 47 years ago. The DSM and ICD was updated in 2022. Changes since regulating the standards of treatments. Therefore, this study is only valid for the time and it's not been replicated since, so it cannot show its attitudes toward mental health or how institutions treat patients today. Now, the actual participants, staff and patients at the hospital as well as visitors did not consent to enter this study, and this study actually reflected badly on all the hospitals and the staff involved in this study. It can be seen as very unethical due to that. Rosenhan's research led to clinics being heavily criticized and people being unable to trust the diagnostic criteria. This has unknown effects. It could lead to people not reaching out. As said, in study 2, people were denied help who were actually needing it, who were actually going and asking for it, because they may be seen as a placebo patient. Confederates were nervous during admissions. This can lead to them being believed even if they aren't insane. As they were shaking, they could have sped up their talking. This can lead to a clinician thinking that they have schizophrenia. Deception / no protection from harm. Staff / hospitals were affected by the study. They were unaware of what was going on, and the study had undesired effect. People were not going to clinics or the untrusted clinics. Professionalism was questioned. So this video is for paper 2, however Rosenhan comes up in paper 3. I've done the same thing for Bradley and Rain. Even though I have a video on them, they do come up in paper 3 as well. Please use this video for your paper 3 revision. However, I may have a video on Rosenhan coming up for paper 3. However, that is not a promise. Just know that Rosenhan does come up in your paper 3 paper as well as your paper 2 paper, and you have to apply them to issues and debates. So therefore, when you can look at ethical issues or issues of social control in this video that I do touch on but I don't go into much depth on, you may be able to think, okay, so we may be controlling people by putting a label on them. It was very unethical. Just start to think about your paper 3, please.